brain, where it's kind of a continuum. And I got this idea when I was actually listening to a comedian that was talking about, this is the man's brain, this compartmentalized brain where everything's in little boxes and nothing emotionally touches. And then the other side of the continuum, he was jokingly describing as the female brain, where everything is emotionally connected. And there are some gender truths to that, but in reality, we're all on kind of a continuum. And I do personally kind of lean towards that, what we call the noodle brain, where everything is emotionally connected. And that becomes very difficult. But when you have grief or trauma, even if you have a compartmentalized brain, almost immediately you get into this, what we call noodle brain, where everything is emotionally connected and you can't organize it. And so what we do in the Mentally Strong method is try to teach you how to organize your brain to get so that it's organized, it's in compartments, but they're not in these boxes that you never touch, right? Next slide. We do know that if we do not process and deal with our emotions, they will come out in other ways. When you talk just about grief in general, you often, it gets, kind of like your negative thoughts get in there. Other things begin to kind of get in the way of actually grieving. So in the Mentally Strong method, we have these 10 categories. So I've been a psychiatric nurse practitioner for over 20 years. And I know that many of my patients go to counselors and I ask them, what are you doing in counseling? And they'll come back and they'll tell me, oh, well, we talked about this, we talked about that. And that is processing. But oftentimes the client doesn't know what they're doing or what category it's in, because you deal with different things in different ways. The way we talk to ourselves, our negative self-talk, has nothing to do with our grief. And we've got to put it in a separate category so that we can learn, so we can actually grieve. Because when we allow these categories to get all scrambled up like that noodle brain, we can't function. And we feel like, well, for me, I call it an emotional mess. Like I can't organize my brain. I can't make good decisions. I feel depressed, anxious, those kinds of things when we're not putting them in an organized fashion and not taking the time to grieve. If we go into the next slide, we talk about grief is also something that is hard. And that's why we're talking specifically today about intense grief, because everybody experiences grief. You will lose someone in your life. You will lose things, so everyone kind of talks about grief very broadly. It's like, oh yes, my grandmother died. I lost a job. Like there's physical and abstract grief, and any loss by definition is grief, right? And so everyone experiences grief. We have to know how to kind of process that. But intense grief, there are griefs that are just so out of context with what we believe should be happening in our lives, like losing a child. Thank you for sharing, Marcella, about losing a child. Thank you for sharing, Lisa, about losing a child. Like this is not the way it is supposed to happen. And it's an intensity that is like, it doesn't seem to fit into this little definition of grief that everyone experiences. Going into the next slide, this is actually the only picture I have of all of my children. So that's my husband and I. We adopted 5 children from the foster care system, and the 2 littlest are our biological children. And this is the only picture that we have of everyone together. We had adopted those 5 children in 2004. And in 2005, Johnny, who is in the, right in the middle, actually, the young boy that looks like he's about 13 years old, right in the middle, that's Johnny. And we were on a family vacation in Kentucky, and he had only been in our family a year. I was just getting to know him, and he drowned in a drowning accident on our vacation. And that began this intense journey that I now am calling the mentally strong journey. At that time, I was literally just scrambling to take care of. He has two biological sisters, and my attention was going to them and trying to help them in their grief, and really just surviving. Not soon after that, maybe a year or 2 years after that, my biological son, Reggie, who is in the bottom corner there holding the football, he began having catastrophic seizures where they would not stop. And doctor's appointments and trying to figure it out. It took him about 2 years to diagnose him with DRPLA. And that is a very rare genetic disorder that either my husband or myself have when they diagnosed him. So soon after that, they took genetic testing for myself, my husband, and my other biological daughter, Maya, who is in the bottom corner there, the little one. And it came back positive for my husband having DRPLA and my daughter, Maya, having DRPLA. In the midst of that, and trying to take care of the fact that although my husband and my daughter were not sick, Reggie was very sick, and his epilepsy could not be stopped. I mean, he would have 12 grand mal seizures in a day's time. And I am basically in fight or flight mode at all times. Well, Johnny's biological sisters were coming into their teen years at this time. And you can imagine they were adopted from the foster care system with both physical and sexual abuse. And so when they got into their teen years, that manifested in very dramatic ways. And, I do have a book that kind of tells our whole story. But in this time is when I was developing the Mentally Strong method. But I didn't think it was going to be about grief. And although I did grieve the loss of Johnny, he had only been in our family a year, and the intensity did not necessarily feel like the intense grief I know now. On October 30th of 2016, Reggie died from DRPLA. And Reggie was very sick that whole time. So from, almost 10 years of doctor's appointments and, just always fearing that he was going to die, right? And so, it was that fight or flight. And so I understand anticipatory grief. I understand fear of death. I understand, and then actually fighting for 10 years and losing the battle. After his death, I began to, like I always do with everything, like, how do I take care of myself? So I had developed this Mentally Strong method, and I was using it on myself. But wow, grief like this is different. And so that's when I started doing what I call controlled grief, and we'll talk about that. And then my daughter, although was showing signs of DRPLA, she did have seizures, but her seizures were controlled with medication. She did have developmental problems, but she was happy and physically healthy. And we were, in my mind, I had anticipatory grief. I knew that she would likely succumb to DRPLA. But honestly, in my heart and mind, I believed that I had at least 10 years left with her because she was physically fine and she was not sick like Reggie was sick. And so again, a sudden death. December 14th, just last year, it hasn't even been a year yet. In her sleep, probably somewhere between 3 a.m. and 4 a.m., she just died. I found her in the morning, I was doing CPR on my dead child. And so we're going to talk about grief versus trauma, because that morning is traumatic. But we have to separate those two things. And we're going to talk about some of that. So, and then I'm still in this process of anticipatory grief for my husband. My husband is still with us. He's in a wheelchair. And, his seizures are controlled. He's, doing fine. He looks healthy. But there is absolutely no treatment for DRPLA. It is causing atrophy, which means killing brain cells inside of the brain. So I still have this anticipatory grief around my husband. So unfortunately, I'm an expert in grief. And I have to, almost chuckle at that. Like it's so intense. But if I'm still standing, I want people to find that strength, because it has to come from within. You will not be able to get it from someone else. You have to find it in yourself. If we go to the next slide, the intensity of grief that we're talking about, when I tell my story, it is not to minimize someone else's story. There is nothing like intense loss. I don't care if it's once or, a lot of times. Like it doesn't, but the way that we handle it is the same. But if we don't handle it, these are two choice opportunities that we use in the Mentally Strong method. One, the one with the soda can is for the kids, because they don't know what teapots are, right? But it originally was about, a teapot, like a boiling teapot. You're making tea, and that boil inside of your heart as you are feeling this pain of grief, if you hold that lid down and not feel that pain, you will explode. You'll emotionally explode. So when a trigger comes at you, you'll, cry, or you'll, respond to that person negatively, or just have a reaction that you don't feel like you have control over, right? Because it's too much intensity to put it in a box. You can't do it. If you are physically or emotionally capable of keeping it in a box, I guarantee you it will come out in a physical manifestation. So when I say physical manifestation, I'm talking even disease states like fibromyalgia or, other inflammatory disease states, because that intensity, that pain has to be felt. And so your body will compensate if you're not actually feeling that pain. So what do we do about it? We want to fall apart, right? There are many times, and falling apart for short periods of time is what controlled grief is. Okay. Controlled grief is, giving yourself that grace. I'm going to start crying because my mom just came on here. But anyway, I lost my train of thought. We want to fall apart. It's okay to fall apart. It is okay to take that time. And so what I have been able to do is what I call controlled grief. And I want to teach this to people, that this is how we actually process this, and that we take the time to actually feel that pain. And if we take the time to feel that pain, over time, the intensity and frequency in which we have to feel that pain will decrease. Now, on the next slide, you're not switching slides. Oh, one more. You missed one. That's okay. So we always hear from, even in elementary school, I think we were taught that this grief cycle of denial, anger, bargaining, depression, and then finally you accept it. In intense grief, we'd have to throw that out the window. It's not a reality. That and even in some other griefs, it's not a reality. And denial really, sometimes we say, oh, I can't believe this. It's not that we're denying it happened. Like it's shock. And even now, sometimes when I'm doing my controlled grief, I'm like, I can't believe that this is my story, that I'm having to do this, right? So denial and anger and bargaining, depression, they can all kind of come up sporadically, but it's not a cycle. It's not a, you do this, then you're done, and you do this. It's not a steps. You don't, go through these steps and then accept, right? There are periods of time where these things pop up. I know if you've experienced intense grief, you have experienced symptoms or depressed mood, maybe even clinical depression. And if you have experienced clinical depression, please seek professional help for that. Even and getting to that point in intense grief of wanting to give up, even thinking or talking about suicide, that is a reality of intense grief. And, we have to make suicide not an option. Like, I need you to make that decision that is not an option. But I like to talk about feelings of suicide as a feeling instead of as an action. I would never kill myself. But there are times where I feel like I understand suicidality, that I could kill myself, or, and it's hard to make that line, but it's more of a feeling than it is a action, and acknowledging it as a feeling. And acceptance is not acceptance. For me right now, it is being present of where I am. And that the pain of losing children is not going to go away. And many intense grief will never actually go away. But this is why I'm talking about controlled grief, of taking the time to feel that pain, the intensity and the frequency in which you have to feel that pain will decrease. And so, it's about making sure that you're taking that time. So on to the next slide. So how do you actually do controlled grief? And I was talking to a couple therapists one time, and they were like, well, control, that might be a trigger word for people who have experienced trauma. And I actually want to challenge that. I want you to be in control of your emotions, your grief, not someone else in control of you, right? I want you to be in control of that. And if you've experienced intense grief, you do not feel like you're in control. And, sometimes, people look at me and they're like, oh, you're so strong. I don't see how you're doing it. Well, I'm going to share with you how I'm doing it, because I struggled with depression before I had a reason to be depressed. Like, I'm not this person who is just stronger than most people. I've just done a lot of self-development. I've refused to give up, and I will continue to figure out how to take care of myself. And then I will share it with other people. And so it's not about one person being stronger than the other. It's about knowing how to actually process grief. First, identifying the grief, which in intense grief is not just that you lost your child or you lost your husband. It is what are all the other things that you lost? I will never get to walk my children down the aisle and get them in, I will never, attend their, graduations and things like that. And for me, I have no biological children left. And so, like, my motherhood. So grief and loss is more than just the one event of death, right? And so first in controlled grief is starting that list for you. What did you lose? And also for me, I lost a belief in miracles. I lost a belief in, like, if you work hard and fight for something, you will win, right? I mean, I really fought to treat Reggie. And we traveled around the world to try to find treatments for him. And it also, how it's not in line with your personal vision. We always talk about people who have a personal vision, a goal, a way of looking forward are always more successful in life. And so if you, got married, you had kids, you were, finished your college degree, you had these plans to live happily ever after, and then your child dies, or then your husband dies. Like, that it's like a cut in the middle of what you thought was a positive projection. So really kind of taking the time to identify the magnitude of your grief in grief alone. So when we go into the next slide, we talk about taking that time and doing it in the sense of, like, really, and originally I was like, 20 minutes. Honestly, it's several hours for me. And I have to do it in the evening, because if I try to do it in the morning, it ruins my whole day, right? Because you've got all of these emotions up and out. So I typically will schedule a time in the evening to do what I call controlled grief. Now, I have pictures of my kids all over my house. But honestly, and even in my office, but I'm so busy and distracted, I'm not actually looking at those pictures and remembering things. So it's not just about having pictures, it's about the intent of taking them and looking at them and looking that person that you love in the eyes through that picture, and allowing the emotion that will start to come up to actually come up. Because our natural instinct is what I'm doing now, right? Is as I'm talking about it, I'm pushing it down so that I can finish my presentation, right? And this is what we do all day as we're being triggered by things around us. And we have, and this is why controlled grief is so important, because if you don't take the time to do it, it will come out throughout the day, when you don't want it to come out, and starts to, and it will impact your day to day. So for me, pictures, I'm a very visual person. I also have some video recordings of my children, and I have some just audio recordings of Maya on my phone. And I just sit in the grief, in the pain. And it's so opposite of what we want to do. And one of the things that, anyone who's experienced intense grief knows is that it feels like everybody else gets on with their life a week, 2 weeks, month later. And for us, everything changed. And, how do we actually feel that pain? Because it feels like it would kill us if we let it out, right? And so, back to the whole teapot, mentality of it's boiling. If you just crack the lid a little bit and let some out, even though it's still boiling, and intense grief, it may boil for the rest of your life. But you've got to take those moments to let that out, or you will explode, either emotionally or physically. So in the next slide, we're kind of talking about making sure that we take the time to feel that whole range of emotion. So when I talked about this controlled grief, there's two. There's emergency ones, and then there's the actual scheduled ones. Okay. So I was talking about the scheduled ones before, right? Like the anniversary of the death of Reggie is coming up October 30th. I will take literally the whole day to do controlled grief. I'm going to be doing a 45-day, 1 hour a day controlled grief between the day that Reggie died and the day that Maya died. And those are like scheduled controlled grief so that I can make sure that I'm getting these things out. But what happens when a patient comes in, or even like after finishing this presentation, I will have to decompress. Like I have to let some of that out. And those are kind of the 20-minute, in the middle of the day, it's okay to cry and then get it, back together. And then also triggers and they happen randomly when you do not expect them at all, right? So, for example, I'll have a patient come in and I'm, going through their intake and then they're here because they're suicidal because their 25-year-old son just died last week, right? Like I can't allow that trigger to make me fall apart at that moment, right? I need to be present for that other person. And so, going back to that grief slide of, it's not about acceptance. It's about, can we be present where we are right now? And so I'll have to, I get that trigger. Obviously it's a trigger. Sometimes I share my story. Sometimes they know my story. Sometimes I don't share. It really depends on the moment. But making sure that I can stay in control of my grief at that moment when I'm triggered by things, if I don't want to allow it to come up, right? Remember, we have to allow it to come out sometimes. And, recently it's been, I've been doing some of that, like I'll get triggered and I realize that it's been 9-10 months, since Maya's death. I haven't even really started the grieving process for Maya. And I know that, and insight is important. So sometimes now when triggers come up, I will just, take it at that moment because I'm having a hard time actually bringing it up. And I can share a little bit about that. But when you start to make your controlled grief plan, make a plan. Like, if you are new in your grief or even old in your grief and you've never actually processed the grief, a lot of time, maybe an hour a week. But then, that should allow you to decrease. So when I say decrease, you should notice a decrease in the things that trigger you. You should notice a decrease in depressed mood, anxiety. You should notice a decrease in the intensity of the grief when you do have it. And that tells you that you can, maybe have these controlled grief sessions a little less frequently. So what is super important, next slide, is what not to do. And grief is so painful, it feels impossible not to have all of these other things come up in your grief. And so when I teach the Mentally Strong method, which, really can't be done in this environment, it's an 8-hour live course that is the way we do it. But we teach you about all of these different categories and how each of these categories have a different response. Not everything you do the same. So, if I'm grieving and I'm truly doing controlled grief and I'm trying to use positive thought to take care of my controlled grief, no, I've already lost my children. That's not going to help. But it will help when I start beating myself up and I say, I was a bad mother, I didn't do enough, I should have done this, right? And so we'd have to take that grief, the pain of the grief, and separate the other components of that into other categories. So I talked about having to do CPR on my daughter that morning, and that is trauma, 100%. But that is not the way I want to grieve my child, right? I need to separate trauma and grief. And those of you that are working professionally with people, we have a lot of clients who are, have experienced both trauma and grief, and it all gets meshed up. And if you've experienced trauma, you probably have a lot of negative self-talk. And if you've experienced grief, I don't know anyone who's experienced intense grief that doesn't have some negative self-talk around that, right? But we can take that negative self-talk, replace it with positive self-talk, right? But when I say take that time for controlled grief, you are not allowed to allow these other things to happen. You are just feeling the pain of the grief. And knowing the mentally strong method allows you to go, because this is what we do. When we start crying, then we start thinking negative and we start going in these, rumination circles, but it allows you to stop yourself and say, no, this is my scheduled time for my grief, not that, right? And so, really being able to separate those things, separating, grief and trauma, you have to grieve trauma. So I have to grieve what I experienced that morning when I found Maya. But in trauma, you're grieving / processing it and then releasing it. In grief, you are feeling that pain, processing it, but then cherishing it. The end intent is different. And so that's why it's super important to have those things separated. Injustices. I have a couple friends who have lost children to pretty significant injustices, drunk driving accident. I know Lisa shared about an overdose. This is an injustice. What is happening to our children is not fair. There's system problems around it, and there's anger, but don't let that get mixed up with your grief. So that's why injustice is a separate category, because we actually deal with it differently. In an injustice, you identify what is the injustice, process that, right? Remember in the very beginning, I talked about having a list of all the things you have to grieve. But with the trauma and the injustice, you have to process it and then with trauma, you have to let it go. And with injustice, you have to make a choice. So I know there's a lot of, like Mothers Against Drunk Driving, right? That is a choice. You take that injustice, you take your pain and you turn it into purpose, right? And so injustice does have to be processed as a grief, but there could be an action. But it also could be an action of not doing anything about that, like focusing on something else. For me, I probably won't spend a lot of time in DRPLA research. Research takes 20 years. We were involved in a lot of research studies and things like that. But I know there's a lot of mothers that lose their kids, or spouse or someone they love very dearly to a, medical condition, and they, take time and make action to kind of address some of those injustices. So injustice do have to be grieved, but there's an action at the end. Do I want to do something about it? Do I not want to do something about it? Behaviors and choices. I'm encouraging you. You don't have to do anything, but I'm encouraging you to take that time for controlled grief, but also taking time for self-care. This is like a buzzword. Self-care is a buzzword. Everybody's saying, oh, you got to learn to take care of yourself. I just turned 50 and I'm just now learning how to take care of myself. And I've done a lot of self-development work. Like we say those words and then we list things, but it's not the same for everybody. And so loving yourself is like learning to love things that love you back. I like to use food as an example. I mean, food has always been kind of an issue for me. I gain weight, I lose weight, I'm on a diet, I'm not on a diet. I definitely am an emotional eater. And, am I choosing food that loves me back? Right? It's not about, eating. I enjoy eating healthy. am I choosing food that is healthy for me? Down at the bottom, a whole nother category around addiction. Addiction post grief trauma is very, very common. And so for myself, I have a lot of addiction in, my father's side of the family. And I know I have addictive kind of qualities and personality. And so when I had to put rules on myself, I do drink a little bit and I put rules on myself. I'm not going to drink alone. And then I stuck with those rules. So, but, kind of separating that. And I think this is what happens. Well, I know this is what happens. It all gets meshed together. Maybe you have a friend, maybe you're trying to help somebody who has intense grief or trauma, and they have all of these things and it's coming in all at the same time. And, yes, I deserve to have a glass of wine every day because I lost my children. Like I really believe that, but that's not good for me. And I know that can lead to addictive things. So I have chosen not to drink alone, which means I can't drink every day. So, kind of making sure that we're putting these things in their appropriate categories so that we know how to actually make choices and make new personal visions, which is the hardest thing to do after intense grief. Like all of your visions and your goals included this person, and now they're gone. So who am I? Who is Cristi Bundukamara? Who is Christy West? My maiden name. Like, who am I without a husband and children? And those are the things that we have to begin identifying and figuring out and working towards those personal visions. Yeah, next one. So I got it all out. We have about 15 minutes for sharing and questions. I really encourage people to, think about this controlled grief and really the mentally strong method can be summed up in 3 words: think, organize, and choose. And we have to learn how to think through our problems, but also learning how to organize them. And I think this is the missing piece in a lot of things that we're trying to teach people, is that they are, they're talking through their problems. They're trying to process them, but there's not an organization to it. And when there's intense grief or trauma, it all gets meshed together, and we've got to separate those things so that we can begin making choices to move forward. So I hope that was helpful. I don't know if anyone would like to share some things that have been helpful for them in their grief journey. Pam, you're unmuted. Did you want to talk?
Oh, I didn't know that. I'm sorry.
No, that's fine. Did you want to share?
I think the biggest thing that one of the biggest things that I learned going through your program was to learn to love myself and to forgive myself for some of the things that I was grieving, some of the things that perhaps I wish I would have done and didn't have the time to do. As you look back, it's real easy to say, I wish I would have done this or wish I would have done that. And, Heather helped me through those pieces and made me realize that the things that I did were also important, just as important as things that I thought that maybe I should have done. So that was huge for me, not to feel that guilt,
Yeah. Good.
So.
Good. Lisa, I know you're a professional and a grieving mother. What did you get out of this time, and what could you add with your professional experience?
Yeah, so actually I was just about to share. So for me, the biggest thing that I did when I was trying to heal was I shared songs with my son. Music was one of his loves. He loved to dance, and I always danced with my kids when they were little. I used to put the headphones over my belly when I was pregnant with him. I was a very young mother, unfortunately. I was one of those girls that got pregnant in high school. So, I kind of grew up with my son, and so that was like something that we really shared. And so I would have these moments where I would hear the song that I played at his funeral, or a song that we shared in the car together, or whatever. And I would literally start crying, and it would take me down for the rest of the day. And I would literally be unproductive and just miserable the rest of the day. And I learned to kind of take that moment to listen to the song, cry as hard as I possibly could, and then go back to work, no matter how horrible I was feeling, or go back about my day, no matter how horribly I was feeling. And I learned to kind of time it in that.
So you were doing controlled grief. You just didn't have a name for it. So, there you go.
when I took this webinar that you presented a few months ago, I was like, oh my God, I was literally doing that. And I didn't realize, but listening to you talk about it and listening to the tools that you use really just emphasized what I was doing and what I was going through. And it just really reinforced it. And it made me so much stronger. And, with me being a grief coach, I started using that a whole lot in the way I coach my participants, because, that was something I was doing, but I was not using that with my participants. But after I heard you talk about it, I was like, oh my God, that's a name for it. There's a name. And
yes, so Lisa, let's share it.
Yeah. So I started sharing that with my participants, and the success that I've had with them, doing that has just been tremendous. And I get text messages from my participants all the time, just, how much stronger they feel, and how nobody's ever told them that, I have a couple participants that go to therapists, and no therapist has ever told them that. The therapist just says, well, you need to think about other things. You need to find things to get you out of that mode. You need to find things to not think about your grief. But I've learned that not thinking about your grief is just putting toxicity on something else. You know what I mean? It's going to come out, just like you said. And so, for me, it's more about bringing that out and really dealing with it and really talking about it. And, what happens a lot of times is when we're doing that, there are other things that start coming out, other depression, other anxiety, other things really start coming out, and we're able to deal with all of it. We're able to deal with the grief and some of the other things that have been bothering somebody, leading up to the death or after the death, or because, remember, our grief is not just about losing the person. It's mostly about the things that we'll never be able to do. I'll never get to watch my son walk down the aisle. There's all kinds of things that we grieve, and that makes us depressed, and it makes us upset, and it makes us unproductive some days. So it's really worked out quite wonderfully for me. So thank you so much for giving me a name to use.
We'll definitely talk after and figure out how we can kind of coordinate some of the things we talked about. Marcel had asked about kind of clarifying what I said about acceptance, because, and you probably have, looked up this, cycle, and we're supposed to get to acceptance, and you're like, I will never in my life accept this. And what I have, and I said that from the day Reggie died, like, I will never accept this. But I'd like us to change that word to present. Can you be physically, emotionally, mentally, spiritually present where you are in your life right now? And hopefully the intensity of that will improve over time. But being present. You have lost a child, lost a husband, had this intense thing happen to you that changed you forever. You are not the same person you were before, but that doesn't mean you can't be a better person than you were before. And it doesn't mean that you can't be present in the reality of what has happened to you. And so I'd like you, if you're learning, if you're reading about different grief things, if someone says acceptance, it was actually always a trigger word for me, like, no, don't tell me acceptance. It's not a real thing for grieving mothers. But now I've changed that to present. I can be present. And this takes time. And I want to, and that's the other thing about a lot of these grief processes. They say, 1 year from losing a child. I don't even think you start grieving until the second year. I think you're literally just surviving that first year. And so it's been 5 years. Will it be 6 years? I can't even count anymore. I think it's 6 years, October 30th, of Reggie's death, right? And so right before Maya's death was the 5-year anniversary of Reggie's death. And I was feeling confident. I was like, you know what? This controlled grief thing, that it actually does work. I'm practicing what I preach, and it actually does work. Like, of course, I'm so angry. I'm still sad. I'm like, I feel all of those emotions of losing him. But I was getting to the point where I kind of felt like I could do this controlled grief on anniversaries, birthdays, holidays, maybe every couple months, but that I was okay. And I also have a strong spiritual belief system. And, it's also important. And I forgot to mention, spiritual conflict is a category all by itself. You have got to wrestle with the fact that to know where your child is, where your husband is, like what happens after death. In intense grief, you have to wrestle with that. And I thought I had a strong belief system, and it gets pulled out from underneath you. And so, but 5 years of active controlled grief, I was feeling a little bit of confidence. And I can tell you, like I said, Maya just died 9-10 months ago. I haven't even started. And I know that. And I'm kind of preparing for like a 45-day grief process between Reggie's death, October 30th, and Maya's death on December 14th. And I'm actually going to make it public. If anybody, I think I'm going to be going live on Facebook and Instagram and TikTok, and really just raw, this is my controlled grief over this 45 days. And hopefully I begin to unpack Maya's death. Because like I said, it was a shock that, I didn't think it was anywhere near time. And I know I haven't even started that process. And so also making sure that you're giving yourself time, because grief takes time, right? And it may feel like, well, I did this controlled grief every week for a month and I still feel horrible. And I talked about this, like if you are experiencing severe depression and anxiety, especially if you're considering or having thoughts of suicide, please go see a professional. Grief is a natural process, but intense grief is complicated, and you've got to get treatment, when you get to that point, right? So, it's hard because it's a normal part of the grieving, but absolutely my line is when you start thinking about hurting yourself, you've got to go see a professional. But I hope that answers Marcella's question about what I meant of kind of changing that word of acceptance to being present. Was there another question, or is that okay? Perfect. Does anybody else want to share? We only officially have 3 more minutes, and I want to respect people's time. Okay. So Jada will be sending a follow-up email and just thanking you for joining us and kind of sharing, about our programs. Next week, same time, I'm doing a Raising Mentally Strong Kids free webinar. The following week is actually a PTSD and veterans specific free webinar. And then we have our classes coming up, Raising Mentally Strong Kids on the 18th and Healing Through the Mentally Strong Method on the 28th. So we can do online CEUs for the Healing Through the Mentally Strong Method. It's a slightly different course, but so we'll have to have you kind of log into the live webinar, which I'd prefer you do, and then also log in and kind of click through the online course to be able to give you CEUs. Someone asked about CEUs for the Healing Through the Mentally Strong Method. We do not have CEUs for the Raising Mentally Strong Kids yet. It's our first time teaching it. It's a brand new curriculum. Cool. Any other questions? I don't know. It's hard to look, watch the screen, watch the PowerPoint. But yeah, actually, is this your cell, Lisa? I'll call you right now. Yeah. Okay. Perfect. Okay. Perfect. Thank you, guys. Thanks, Mom, for making me cry.
Thank you, Cristi.
All right. Bye-bye.